Lower back pain, numbing and burning feet are the most common ailments that people experience, but most of the time they ignore these symptoms, which can be an early sign of sciatica.
I will put the leg to 60 degrees and I use my leg for the support, then I do flossing.
Dominic is 36 years old and works in the hospitality industry. He says one day he was lifting some loads like he always does at work, but on this day he couldn't lift anything.
It started one day. I was lifting some things at job, and it was, I think, around evening. I had some logs to lift at the job, and it was difficult for me. Actually, I could not even bend, because when I bent, I could just feel a very sharp pain from this part of my neck. Then it could trigger to my back side of the lower shoulder. I noticed there was something wrong. Then I went to my nurse and explained everything to her. She gave me a deep heat spray, but it did not work. The second day, when I went to work, then it wasn't to an extent of I could not move at all my neck. Then people could say, maybe you have a stiff neck. But I said, no, it's not a stiff neck.
At this point, he decided to seek a doctor's advice before he was referred to a physical therapist.
At that time, I had a lot of pain, honestly, at my back, at my shoulders, and even at the neck side, and part of my abdomen. But now, after I came,
were you able to sit, walk well?
Okay, I was able to sit, but not too much. I could walk, but not with a lot of strain. Like, for example, we are men. We like to be strong in everything that we are doing, in walking, and many other causes.
It was a new experience, and the first time he was experiencing a physiotherapist.
Okay, we don't take this physiotherapy seriously, by the way, because there is healing of touch. Because physiotherapy is all about touch. Your muscles, maybe my neck muscles, my back, and even my spinal muscles. Then I said, no, I have to trust, because it's all about trust. Because healing comes after trust. So I had to trust this person I was referred to by Dr. Pais. When I came, when I met her, I was just cool. Listened to me very well, gave her my story. They said, Dominic, you are at the right place. And I told her, I believe.
I hold for 10 seconds. Back. And you repeat for 3 times, 3 repetitions, 3 sets, I mean.
The physiotherapist informed him he was suffering from a muscle and nerve problem that might have been triggered by lifting heavy loads.
Sitting on couch for a long time, like maybe you are watching movies, you are praying, maybe you are playing soccer sometimes, and such things. Doing exercise that you just twist your body in a bad position, that could trigger to such things. Maybe in job, you are lifting things, you're bedding, lifting, all those things. She explained everything to me, and I told myself, no, I think I'm in the better place, because those are all the kind of things I've been doing. Even at the house, you can lift, maybe no water. You are just in first floor, second floor, third floor, and you're fetching water at first floor. All those things you can carry, like men we love carrying two jerrycans of 20 liters each. Those can trigger to such things. So that is what the doctor explained to me. Then he examined me very well, and after the examination, she told me, now I have noticed all the problems that you have, why you have come here. And then we started physiotherapy.
He explains he got massaged in all the areas where he was experiencing pain. He felt as if every muscle was being stretched.
So the second day, he did not do the same thing, but he just went to an extra mile. Now touching each and every muscle in a very scientific way, I can say that. I can use that word, by the way. And it was not bad, it was good. But it was not that the pain did not go completely. Now there was not, I could feel now there's something that is happening to me. Because second day, okay, the movement of my neck and the movement of my body was not that bad. It was good. Come second day, the third day, that is the day I think she worked on me very well. And okay, the neck part now, I don't know how she did it, but I could feel everything, because now the neck part, she massaged it gently and gently and firmly, to an extent of that the muscle is now relaxed. That was for the neck, it relaxed completely. Then we continued the same treatment, same massage. The fourth day, we went to the back and the spinal cord, each and every part of the muscles, and I was feeling better each and every day.
When you bend, I put my hand behind your back. Allow me to put my hand behind.
Sciatica is the low back pain that radiates downwards into the left or right buttock, into the leg, and sometimes into the foot, following the sciatic nerve pathway.
Tuck in, Kapsa. Then as you tuck in, press my hand down. Press my hand down and make sure you can still breathe in and out. Don't hold your breath. Yes, that way. Don't hold your breath.
In some cases, the pain can be excruciating. The bottom back of your leg, foot, and toes will feel weak, numb, painful, and tingling like pins and needles. Despite the therapy, Dominic continued to take some nerve medication and painkillers that his doctor had earlier prescribed to him. When we spoke to him, he had already done 8 sessions out of the 10 sessions of physiotherapy that were recommended for him. On his account, he was feeling better.
My back and my shoulders, you can see my shoulders are good now. I can move at least, because I could not move. I could not afford to smile, because when I move like this, the sharpness of the pain could trigger, and I could just like a statue. I cannot move further. Then people could notice. But now I can move. I can give you a smile, and good one, by the way, because of the good job Dr. Sarah has been doing to me. Yeah.
And then, as a man, when you come to physio, people will be like, I don't know, I'm sure you're married. So telling your wife, I'm going for massage, and then your doctor is a woman. And then Kenyans, we feel, physiotherapy ni kushikwa, literally. How did you, first of all, accept that, I'm sick and I have to go through this?
Okay, for me, I can say that is a very bad, it's just an imagination.
Yeah, most of us have that imagination. Yeah.
But I need to tell you, these people are professional. Dr. Sarah is professional, first of all. And for me, I believe, first of all, I'm a Christian, and I believe. My wife is also a Christian and a strong believer. He believes in me, this on me. I also believe in her very much. When I told her, she understood everything, because she could see in the house, even sleeping was difficult. Just like, what is not happening with my man? Then I explained everything and said, as long as you'll be safe and you're okay, you're good to go. She did not complain at all. She told me, just go. You'll be healed. Yes.
So basically, those who maybe just hear of physiotherapy, they should know it actually works.
Actually, for me, I can tell them it works. Then it works. I've experienced this myself, by the way. There's no like bad thoughts or imagination or thinking. No, not at all. Because the first day was Dr. Sarah, the second day he gave me another doctor, our colleague.
Even though physiotherapy is assumed to be expensive, Dominic says there's nothing expensive with your health. He was taught extra exercises that he can perform at home even after the end of his physiotherapy sessions.
So stretching, remember you have to hold it for like 10 seconds, 3 times.
Sarah Konzie, a physiotherapist and a specialist in orthopedic manual therapy, explains that physiotherapy is part of clinical medicine that helps to restore normal life after an injury that affects the physical body, like the muscles, the joints, nerves, tendons, and the spine. 70% of physiotherapy mode of treatment uses hands, while other 30% uses machines known as electrical physical agents.
We deal with so many conditions, and we deal with conditions like stiff joints or stiff muscles, which may be caused by a condition like arthritis. We deal with arthritis because of the stiff joints and the stiff muscles and the weakness of the muscles. So we also deal with problems with nerve problems, like somebody can have nerve problems on the upper limbs, the hands. You find the nerves which come from the neck. They make your hands, you are not able to hold something, or you have tingling sensation or some needles just on your hands. And nerves problems like the sciatica nerve, which usually originate from the lower back and runs down to the leg, to the toes. We deal with that. We also deal with neurological problems like people who have problem with balance or stroke rehabilitation. We also deal with people with problems like vertigo or vestibular problems, whereby you find somebody, if you turn to your right or left, you just turn like that or like that, you feel dizziness or you feel like the world is spinning. We also deal with that because we just put the liquid which is bringing that issue to its position, and then that problem goes. We also do with or deal with women health, like women who have incontinence, or after birth you have some issues with incontinence or some pain during intercourse. We also, as a physiotherapist, work on those muscles with physical treatment. And lastly, is there anything I've forgotten? We deal with a lot of sports problems, any injury of the tendons, of the ligaments. In physiotherapy, we work with that. We also work with problems after surgery, like somebody has done total hip replacement or knee replacement, all shoulder reconstruction. We also rehabilitate that person to go back to complement the surgeon's work. Because once you have done a surgery, you are not able to walk, you are not able to do your normal duties. So that's our work as physiotherapists, to make sure you go back to your normality and enjoy life after any injury. So, like we have said, stretching the hamstring and the flossing, you can use the Mulligan belt or a lasso or a sheet.
Sciatica can vary widely, from a mild ache to a sharp burning sensation or excruciating pain. Sometimes it can feel like a jolt or electric shock. It can be worse when you cough or sneeze, and prolonged sitting can aggravate symptoms. Usually, only one side of your body is affected.
So in between those bones, there's a disc, which is usually a fluid like a gel like. It's the one which makes our spine flexible. You can bend, you can side bend, you can rotate, because if it was just one bone of the spine, you could not move. So the disc is the one which now becomes as a shock absorber and brings flexibility of the spine. So once the disc it has been put pressure on it, it can bulge. It can come out from its space, and the space which goes, if it bulges, or the way most words we use like prolapse disc or disc bulging, the space it gets is the space of the nerve. So that's why it now irritates the sciatica nerve and now sends the radicular pain, or the pain of the leg, or the numbness, or the coldness, or the burning sensation. Another cause is the bone itself. You might find like you have fallen. Most of the time people fall from bathroom and they sit on their buttocks, or they slide on the stairs and they sit on their buttocks. You find the bone, the lower back bone, moves a little bit, something called spondylolisthesis, which can now cause also irritation on the nerve and brings that sensation of the leg. Another cause, it can be age, which we associate it with arthritis of the spine, which it has those special terms, we call them spondylosis. So if there's after 35 years and above, because the spine is wearing in and out, you find it can cause it can irritate the nerve, because what happens, there's that wear and how the bones keep on wearing, and it's kind of, they bring sharp ends on the bones. So those sharp ends, they end up touching the nerve, and then it brings the symptoms. Another cause is an accident, which now affect the spine directly, or a fracture. Another cause is just sometimes this muscle spasms, just the muscles, because of the pain, they get too tight. They can also make the freedom of the nerve not there, and then it brings the symptoms. Yes.
What about maybe sitting too much, because that's what brings numbness of the feet, and maybe carrying out of loads?
So the terms I've used, like disc bulge, it is usually like there's a predisposing factor. Now the predisposing factors which can bring the sciatica problem, it's like lifting everything the wrong way. Most of the time we just bend our back and lift everything, and then what happens is you do that, there's a force, you put more force on the disc, and then it spills from its place. Or you sit for long, that's sitting for long, because the disc are the shock absorbers of the body. You put more pressure because it is on the lower back. The whole center of gravity goes at the lower back. So the more you keep on putting pressure without a relief, it makes the disc to bulge, because it wants to get some relief from the pressure of sitting long. And another predisposing factor, it's driving for long. It's also more of sitting for long, because most of the time people don't use the right posture. You might find I'm driving and my buttocks are away from the back, so I'm just leaning and I'm driving. So you put more pressure on the lower back, and you end up making the disc come out and press the nerve. So those are the predisposing factors, if I can use the right words.
Konzi says the main challenge in treating sciatica is that patients come when the pain is too severe and they can't even move. Yet there were early signs.
What happens once they feel pain, they ignore it. Maybe they say, I've been sitting for long, that's the reason I have the back pain. Or sometimes they say, I lifted something I know that's the reason, so I just ignore it. And sometimes they say, okay, in my family, or my mother, my grandmother complained of the same, so they just ignore it. Or sometimes they say, okay, I'm feeling the back pain and the pain on my leg, and they go for painkiller over the counter. So they just block the pain gates, and they keep on building up the problem. Or sometimes they decide to go to seek medication, and if they go to seek the medication, maybe they go to seek from a different a specialist who will not understand the type of problem they are having. So at the end of the day, they are given painkillers, anti-inflammatories, and the pain is not going, and the symptoms are not going away. So most of the patients we get, they come to us when they have already suffered for long. Okay, there are others because the knowledge is all over the world. When you Google, sometimes they know when you have such a problem, you go to your physiotherapist. They come directly, but there are few. So that's how we get our patients. Most of the time, they are really stayed with the problem.
And what happens if they were still with this problem?
It takes longer time for recovery. Yes, you might find if you got the problem like today and you seek the medication or intervention within a week to a physiotherapist directly, you find after stretching the nerve, the symptoms go down, and now we just relieve. But if you have taken longer time, it also takes longer time to make the body recover, the nerve to get freedom, such things. Yes.
Now, for you here, what are the remedies or therapies, treatments that you give to your patients who come with sciatica?
My patient, when they come with sciatica, first thing I have to examine them and know exactly whether it's the sciatica or it's another problem. Just to know whether it's a sciatica nerve, we have special tests we usually do. One is, we call it straight leg raise. You just lift your leg when you are lying facing up to around 60 degrees. The pain is usually a lot. All just stretch, something called dorsiflexion of the angle. the pain is usually, and it just runs. Or other examinations like movements, like bending forward or backwards or sideways, it will just tell you where the nerve is more pinched. When I examine and know exactly it is sciatica nerve, I have a program for the sciatica nerve. Now the sciatica nerve, first I do something, we call it flossing and sliding of the nerves. Flossing and the sliding of the nerve is just to stretch the nerve from the spine through the leg, and we return the problem to the origin, which is the back. So the more we slide and the more we floss the nerve, the pain goes back now to the leg and to the back, and the leg it's pain free. Then after the leg is pain free, now I work on the back. Now I work on the back according to my examination. If the problem was the disc, I do now some mobilization of the muscles around and manipulations of the joints around to make sure the disc goes back to the position. Like many people come with myths. Once I have a disc problem or back pain with leg problem or sciatica, it doesn't go. But from the research all over the world, they say within 6 months, the sciatica nerve and the disc goes away. Yeah. So I will work now. The pain has gone back to the back. Now I do some manipulations there and mobilization. Then now after that, now I set a program for them. We call it spine rehabilitation. Now I work on the muscles which are around there, especially the core muscles, because when the disc goes back to its position and the nerve is free, the pain will go and you won't feel pain. But the probability of it recurring is high, because once you have pain, the core muscles, they get weak. And the core muscles are not the muscles you can see. They're just muscles around your pelvic area, just inside there. So there are special techniques I use, and we rehabilitate them within 6 weeks, and you get no pain and no recurring pain. Yes. Yeah. Let's try both. Let's go. Yes, one. Now we are working on the lower trapezius. This is where the trapezius they get inserted from the neck.
Rehabilitating sciatic nerve pain takes approximately 6 weeks to heal when it's not too severe. Sciatica mostly affects women because of the roles they play in society.
Back pain with sciatica, most of the time it's on the women. Yes, the higher side.
Why?
Women, they get more exposed to different roles in life, especially after giving birth. Once you were pregnant, the back, after supporting you and you give birth, it kind of brings imbalance, because you are pushed forward and all of a sudden you are flat. So the spine becomes weak, and because of either wrong lifestyle, like sitting for long, lifting things the wrong way, sleeping the wrong postures, you find the nerve can be more vulnerable to the injury of what we had discussed before. So most of the time, also their jobs, you find it's more involving. Most of the time, women don't just sit, they do a lot. So at the end of the day, I think from the research, that's why they say women are more vulnerable to sciatica now.
Back pain with sciatica can affect anyone despite their age. Kenyans are advised not to depend on painkillers alone, but also to visit physiotherapists who can stretch their muscles and help them heal. Beldin Waliaula, KTN News.